Thanks for coming to our monthly board meeting on our complementary and alternative medicine planning. We've been looking at ways to cut down costs and offer more homeopathic options for our clients. Recently, natural remedies are becoming more popular. I know that you've been researching aromatherapies. What have you found?
Well, I have a family friend whose father has Alzheimer's disease, and she told me after she took him to an aromatherapy session that it really helped with his memories.
Yeah, I've heard about that. Apparently, researchers believe that aromas can stimulate your amygdala and hippocampus, which are associated with your memories and emotions.
Yeah, research studies have showed great improvement in Alzheimer's patients' cognitive level.
That's interesting. Does it help with other ailments as well?
It actually helps with a lot of things. On the physical side, it can help with swelling, fungal infections, vomiting and nausea during labor, alopecia, constipation, and even pain related to arthritis, cancer, and headaches. On the emotional side, it also has a lot of benefits like relaxation, calming, relieve anxiety, stress, and depression.
But has it been scientifically proven?
Yes, I've read some research studies that have shown a strong correlation between Alzheimer's patients and dementia patients that has showed that aromatherapy has improved their cognitive function. It's also shown to reduce the symptoms of infantile colic and also reduce the symptoms of menopausal women. When you breathe in essential oil molecules, some researchers believe they stimulate these parts of your brain and influence the physical, emotional, and mental health. Other scientists believe that specifically lavender stimulates the activity of brain cells in the amygdala, similar to the way sedative medications work. And other researchers think that molecules from essential oils may interact in the blood with hormones or enzymes.
Thank you for all of your research. Do either of you know where this therapy comes from?
Actually, essential oils have been used for therapeutic purposes for a really long time, almost 6,000 years. It's recorded that the ancient Chinese, Indians, Egyptians, Greeks, and Romans all used them in cosmetics, perfumes, and drugs. They were also used in spiritual, therapeutic, hygienic, and ritualistic purposes. But more recently, a French chemist named Maurice Fosse discovered the healing properties of lavender when he had an explosion in his lab and he got burned. He then started to analyze the chemical properties of essential oils and how they were used to treat burns, skin infections, gangrenes, and wounds in soldiers during World War I. Eventually, he founded the science of aromatherapy, and by the 1950s, massage therapists, beauticians, nurses, physicians, and physiotherapists were all using aromatherapy. However, it didn't become popular in the United States until about the 1980s.
All of this sounds really promising. Many of the ailments that you listed are common in the hospital and home care settings. Do you know how much it's going to cost us and what we will have to do in order to offer this to our clients?
Aromatherapy can actually be provided in a variety of ways. Through candles, sprays, lotions, relaxing, scent sticks, oils, and even bath salts. Aromatherapy can also be incorporated into massages and even occasionally taken orally.
Other clinics I've seen offer therapy based on what type of oil or herb is being used and whether or not the client is also going to be receiving a massage with the therapy. Prices can range anywhere between $50 to $100, but we can also offer classes to educate clients about how they can use these therapies at home.
Yes, clients can buy the products from their local stores such as Bath & Body Works or even through us, and that can range anywhere from $6 to $15.
I love that there's so many options with this therapy. We can use primary prevention, or we could even, enable the clients to use it in their homes. I'm really excited about this. Let's do it.